Good afternoon. Happy to see all of you here. We're going to have some fun here today. I'm Dr. Sten Ekberg, and this is another installment in our series, User Manual for Humans. And why do we have a user manual for humans? Well, you have one for your toaster, you have one for your hairdryer, you got one for your microwave. Nobody gave you one for the human being. And that's the most important one. So today we're going to talk about cholesterol. And this is, in my opinion, when we look back at this one generation from now, this will be equivalent to the Dark Ages. There is so much myth and misunderstanding, and it's been so vilified that it's unbelievable. So we're going to talk about what it is and what really is good or bad about it. So cholesterol, I call this the good, bad, and the necessary. So we're going to talk about what is it, what does it do, why is it a natural thing, and why is there really no such thing as good or bad cholesterol. It's the greatest hoax since low-fat diets. And we'll look at the cartoon here. And this sort of illustrates the level of understanding a lot of people have. No, HDL and LDL were not the robots in Star Wars. So we'll hopefully raise our awareness a little bit. And the history really isn't that important, so I'm just going to kind of race through it. But it's important to understand that a lot of this is coming from, not necessarily from a need, but from a desire to do business. So 1847, they first found a cholesterol as a component of a plaque. And then 100 years later, they did something called the Framingham Heart Study. And Framingham is a place where they have followed people for decades, and they've traced and studied their heart conditions. And most of what the heart policy and guidelines that we have come from these studies. So in 1957, 10 years into the study, they said, oh well, these people are having issues, we need low-fat diets. And then in 1971, they started isolating different components that they thought could be useful. Well, at this time, they didn't really do it for the purpose of fighting cholesterol, but it's just part of research. So they found something called mevastatin from a fungus. This caused tumors, muscle deterioration, and death in dogs. So they thought, we must be onto something good here. And then in 1978, Merck isolated lovastatin from another fungus. So these are related substances. And in 1985, someone was awarded the Nobel Prize for clarifying the cholesterol production pathway. And this is important to understand. The body actually manufactures cholesterol, and it manufactures most of the cholesterol in your body. Then 1987, Merck releases an anti-statin drug called Mevacor. There's a $600 million a year advertising budget. There's some more guidelines from the government, and they're still talking about low fat. Then in 2001, now we're starting to see what's happening with lobbying, that these companies, they're saying, well, we're giving people these drugs, but they still have high cholesterol, so we need to make stricter guidelines. And this happens through lobbying. So the government changed. And because they tightened up the guidelines, all of a sudden, instead of 13 million people being candidates for these drugs, now there's 36 million people. So through this lobbying, they're increasing their market share. And what used to be a healthy level, all of a sudden was too high. So most of these levels are artificially and arbitrarily created. Another thing that we're seeing change is prior to this, there had never been marketing of pharmaceuticals straight to the consumer. That had always been done to the doctors or to the healthcare field, but now they're bypassing the doctor and they're going straight to the consumer and they're saying, you have this problem, you need this drug, go ask your doctor. And the doctor doesn't know. He says, okay, well, I guess it's a good thing. So now they're starting to put people on drugs from the pressure of the consumer coming to the doctor instead. Mm-hmm. And that's an enormous increase in pressure, so to speak, to expand the market for drugs. And in 2010, there were $28 billion in sales straight for statin drugs, and what they're talking about next is to release these over the counter. I saw some statistic. What was it you showed me? 1 in 4 people over a certain age, and I don't know exactly what the age. It was 40, 50, somewhere around there. And what is all this based on? Well, there is the research called the Framingham Study. And they observed certain facts and they drew certain conclusions. So we'll go over those. The fact was, people with heart disease usually have higher cholesterol than healthy people. That's a fact. 2, atherosclerotic plaques contain cholesterol. 3, these people also usually have a higher ratio of LDL to HDL cholesterol. Those were the facts that they observed. Now, it depends on what sort of philosophy and how you view the body, what sort of conclusions you draw from that. So their conclusion was cholesterol causes heart disease. And 2, they concluded LDL is bad and HDL is good. And from this we have these terms of good and bad cholesterol. Now here's the problem, as it is with most of the research when it comes to drugs and the medical research they do. First problem, there was only a correlation. No one ever suggested or proved that there's a causative relationship between one and the other. All they did was they observed one and they observed the other. So they said, we see these two, they must go together, and one must be the cause of the other. That has never been the case. So they assumed a causative relationship. So here's another thing, like I said, the body produces most of your cholesterol. So nobody here was asking, why is the liver making too much cholesterol? They're just assuming that you're eating too much of it, and that must be the problem. And as usual, they blamed it on the DNA. There must be something wrong with your genes, right? My favorite analogy for this is to illustrate the thing between correlation and cause. Every time there's a traffic accident, I see blinking blue lights. So because I see them at the same time, they must belong together, and one must be the cause of the other. So the blinking blue lights must cause traffic accidents, because I see them there every time, right? Mm-hmm. That's this level of sophistication of thinking, the thinking process that led them to believe that cholesterol causes heart disease. Mm-hmm. So with this, we can say, oh well, if the blinking blue lights cause traffic accidents, and I see those policemen driving those cars with the blinking blue lights, that must be bad policemen. Mm-hmm. Okay? Bad fire department, bad police department. They're causing traffic accidents. And that's absurd, like we can all see. And it's equally absurd with the cholesterol. So we're going to talk about why. That there's no such thing as good or bad. And here's a question that they don't ask. Before they put these labels and draw these conclusions, these are questions they don't ask. What is it cholesterol does? What is the function of cholesterol? Are we supposed to have it in our bodies? So first of all, cholesterol is a hormone precursor. All of the male and female hormones are built from cholesterol. We need that cholesterol as the raw material to make estrogen and progesterone and testosterone. We can't do it without. So the function of our ovaries and testes and adrenals, our stress coping ability, depends on cholesterol. Vitamin D cannot be produced in the body. We get it from sunshine, but it cannot be produced without adequate cholesterol in the body. And now they found vitamin D as the number one vitamin that everybody needs, that it's linked to all sorts of problems when you don't. It is needed for digestion. The bile in the liver that helps you emulsify and process fats contains cholesterol. And most importantly now, we're getting to, it's a component of the cell membrane. And we're not going to get into detail on the cell membrane, but the cell membrane is the microprocessor of the body. It's the brain of the body. The cell membrane is what determines the outside and the inside of the cell. It's the barrier that decides what goes in and what stays out. So because of that, it's the decision maker in the body in all regards. And that's the function of the brain and the nervous system. The function, the reason the brain can make decisions is that it has a cell membrane that can tell the difference between inside and outside. And cholesterol is a vitally important component of the cell membrane. So we cannot make proper cell membranes without the cholesterol. So the permeability and the fluidity of cholesterol depends on this. So if we don't have enough, then signaling and nervous system function of the nervous system can suffer. If we have a lack of cholesterol, it's been linked to depression. And cholesterol is also indispensable for making myelin. And myelin is a fatty substance that surrounds the nerve fiber. And this is like the insulation. If you have an electric wire, it's always insulated by plastic. Well, the body does the same thing, but it does it with myelin containing cholesterol. So the insulating and signaling properties of the brain depends on this. And it's vitally important for brain maturation. So when they're saying that, oh, well, these kids are so unhealthy, we need to get them on statin drugs while they're teenagers, this would be incredibly devastating because it would keep their brains from maturing properly. Ingested versus manufactured. Using a complex 37-step process, so I mean 37 steps, this is not something that accidentally happens in the body for no good reason. That if it goes through all those steps, the body has a reason to make this stuff. The liver produces approximately 1,000 milligrams a day, while another 200 to 300 milligrams are ingested on average. However, this ingested cholesterol, the stuff that you eat, is not absorbed very well. So it's actually, even though you eat 200 to 300 milligrams, not all of that is getting into your body. So that makes the importance of the ingested cholesterol even less in comparison. But furthermore, cholesterol, because it's so important, and most important substances in the body, they circulate. So the body releases them at some point. So the gallbladder releases cholesterol into the intestine, but because it's an important substance, it is being reabsorbed. So we're saving, so we don't have to make so much of it all the time. The body is economizing with this important substance. And because of all these factors, there is virtually no effect on the cholesterol level in your body of the cholesterol that you eat. because when you eat more of it, your body is going to make less. When you eat less, your body is going to make more. So the ingested cholesterol has virtually no bearing at all on the cholesterol in your body. Okay? So what is it that does determine? Well, let's look at a little more specifically what they do. These guys, LDL and HDL, stands for low density lipoprotein and high density lipoprotein. So as the name implies, lipoprotein is something that contains lipids and protein. It has fat and protein in it, but it has different components. So depending on how much protein it has, it's either high density or low density. So something that's low density, the LDL, it's lighter because it has more fat and less protein. And vice versa. So what these carriers, what these do, they are carriers. They're vehicles. It's like a bus. And the purpose of that bus is to transport things. So LDL and HDL, these lipoproteins are carriers. They're like buses. And what they do is they either carry cholesterol out to the tissues if the tissues need cholesterol, or they bring cholesterol back if the body has had enough. So LDL means that the bus is already full of people. It's already full of cholesterol. So if you need to transport these people someplace and drop them off, that's the function of that bus. Then if the people are out there and then they need to be picked back up, then you need to send an empty bus so that you can pick them up and bring them back. This is exactly what LDL and HDL does. There's nothing good or bad about it. If the body needs cholesterol in the tissues, the liver makes more LDL so it can deliver cholesterol to the tissues. If there is enough at the tissues or too much, then the body makes HDL so it can bring the cholesterol back to the liver for reprocessing. So that's the purpose. There's no good or bad. That's just what it does. It's a carrier, and the body makes whichever one you need at the time. What's the situation then where the body makes more LDL or HDL? Well, what's the purpose? The purpose of cholesterol is, like we said, it's all of those hormone functions and all that. But remember, it's part of the cell membrane. So anytime that we have damage in the body needs more cholesterol to repair the damage. And what is it that causes damage primarily in the body? It is inflammation. And they're finding out more and more and more and more that all these degenerative diseases, from Alzheimer's to heart disease to diabetes, is a state of low-grade inflammation. Heart disease is an inflammatory condition. And when you have inflammation in the tissues and you get cell damage to the cell membranes and you need to repair those cell membranes, the body makes more LDL cholesterol to deliver it to the tissues. So the LDL is not the bad guy, it's the inflammation. So if we want to change anything about this, then we just need to find out what are the lifestyle factors that are causing the high inflammation. And one thing that we talk about in this office is stress, because stress has been linked to virtually every disease, and it's linked in this function as well. That you're sitting at a picnic, you're having a good time, and your stress and your healing, your sympathetic and your parasympathetic are in balance. And then the grizzly bear shows up for your picnic, and now things are not so peaceful. You get into a state of stress. And some of the things that will happen is your heart rate goes up, your blood pressure goes up, your muscle tension goes up, your blood sugar goes up. But one more thing that happens is you check out those claws on the bear and they look pretty sharp. So your body, your infinitely smart body says, there's probably going to be some bleeding before this is all over. So just in case, I'm going to prepare to stop the bleeding. And in order to stop bleeding, I have to increase the blood clotting factors. And what's included in blood clotting factors? Cholesterol is part of that cascade. And once we have the damage, we're going to need cholesterol for the wound healing to create new cell membranes, to create all of that. So as soon as we see that grizzly bear, we have an increase in LDL cholesterol because the body is planning ahead and saying we better deliver some cholesterol to the tissues just in case. So even though we don't have that many grizzly bears, we have quite a bit of other stress. Okay? So when you see that grizzly bear and your LDL is going up, your body is doing exactly what it's supposed to. You are not missing a statin drug. Your body is behaving exactly the way it's supposed to during stress. So the problem again is stress and inflammation. It's not about the food that we eat. Unless the food, of course, creates inflammation, that's a different story. But it's not about how much cholesterol there is in there. What are some of the ways to bring it down? Obviously, reduce the need for it. So even though cholesterol isn't good or bad, obviously having high cholesterol is not a good thing because it means that we have inflammation in the body. So as we get healthier, as we learn how to be healthy, meaning eat better, move better, feel better, as we talk about in our long series of user manual, then inflammation goes down and we need less cholesterol to repair the damage. The other way to bring it down is to use a statin drug, a cholesterol lowering drug. And what does it do? What's the mechanism? Well, the statin drug interferes with the liver's ability to manufacture cholesterol. So your body is saying, we want this cholesterol, and it signals the liver to make some more, and we take a drug that destroys the liver's ability to make it. So we have to basically choke the living daylights out of the liver. And if you notice, on all the commercials, what do they say?
Liver damage.
Liver damage, yeah.
Never ever take this if you have any problem with your liver. Because we're going to choke it some more.
Yeah.
So if it has any sort of problem, then we're going to squeeze the life out of it. So you have to have a perfectly healthy liver so it can sustain the damage we're about to do to it. That's why they say that. And what's the effect of the drug? Well, it's going to lower your cholesterol. So it's going to look, on the blood test, it's going to look like a good thing happened. But what really happened is you still have the stress, you still have the inflammation, you just don't have the ability to make the cholesterol.
Wow. So you're not healing.
Yeah.
Yeah, it's just
And this is how most medical research is done. They don't ever look at, are you getting healthier? They're looking at one measurement.
Mm-hmm.
They're looking at blood pressure or cholesterol or some aspect, and they're saying, can we change that one aspect? They don't care at all about anything else that they might be changing in the process. Okay?
It's really a domino effect, huh? You
Yeah.
start messing with one thing.
Yes, yes. And we'll do another talk on drugs and their mechanism,
Mm-hmm.
just so you can see a little bit more of that. What are some of the statin side effects? Liver damage, muscle damage, and what's one of the more important muscles? It's the heart. It can affect memory, concentration, and cause depression. It can create pain and peripheral neuropathy. Again, if you don't have the cholesterol to repair the damage, now your nerves are gonna have issues. Sleep problems, sexual dysfunction, fatigue. If you don't have the cholesterol to manufacture your sex hormones, then you get sexual dysfunction. And one thing that's really important that we've talked a lot about is mitochondrial function. It is absolutely guaranteed that these statin drugs will interfere with your body's ability to use CoQ10. So if you ever get on a statin drug, for whatever reason, if you get talked into it, make sure you double up and triple up on your CoQ10, because your body is going to need it. And with that reduction of CoQ10, of course, your body, the mitochondria are not going to be able to make the energy that's so essential for every cell function. And where do you have most of your mitochondria? Well, in the most active organs, which is the brain, the heart, and the liver.
And then the right one. CoQ10.
Yes,
The right one.
yes, the ubiquinol, the active form. So here's just a little bit of what I mentioned up front, that the guidelines, that the drug companies, they obviously want to make money. So the more clients they have, the more the potential target market, the better for them. So they're lobbying, they're saying, hey, we're doing all this stuff, but people are still getting heart attacks. We must tighten the guidelines. So over the years, they managed to change these guidelines so that more and more people get into the target zone, become a target market. So then this guy at the fast food dining table says, my heart has survived 16 girlfriends, 7 fiancés, and 4 ex-wives. You think my heart is afraid of a cheeseburger? So we want to start understanding the body a little bit differently. All of the traditional risk factors, the things they talk about as risk factors, they're not really risk factors at all. Some of them are quite ridiculous, actually. Being male, that's not a risk factor, it's a correlation, again. Smoking, it's not a risk factor, it's because it increases free radicals and decreases oxygen delivery. Hypertension is not a risk factor, it's an association. It's just another effect of poor health that's observed in correlation. Diabetes, the same thing, family history, got nothing to do with it. HDL, of course, it's another effect. So all of the things that they're talking about are not the risk factors. There's just other things that you observe in conjunction with poor health. And we need to start understanding what the true risks are if we're ever going to get to the source of the problem. The real risk factors are free radicals, inflammation, and degeneration. What are they caused by? Chemical stress, structural stress, and emotional stress. It's what we talk about in all the other installments of the series, and we talk in details about how each of them work and what we can do about them. So that is all we have on cholesterol. We encourage you to learn more and come to other talks that we have. And feel free to ask any questions.